right, good afternoon. My name is Jennifer Nelson. I'm a nurse manager of a progressive care cardiology unit at Penn Presbyterian.
And I'm Staci Pietrafesa. I'm the nurse manager of a orthopedic and general surgery floor at Penn Presbyterian. We are here today to talk to you about mobility and the impact it has for our patients.
Meet Carol. Carol is a 62-year-old who hasn't been in the hospital since she had her daughter 40 years ago. Carol had emergent open heart surgery and a variety of complications. Carol was scared to get up, she was in pain, and she didn't know what to expect. The longer that Carol stayed in bed, the weaker she got. She soon became depressed and lacked motivation. Carol is a typical patient we see on our units. We find that patients spend most of their hospitalization laying in bed. In fact, 83% of the time spent in the hospital is spent in the bed. This equates to 20 hours a day. The idea that rest is best is a sacred cow when it comes to our beliefs about a patient's hospital stay. We know that lower levels of physical fitness and activity are directly associated with increased mortality and increased complications. We also know that when patients ambulate and meet mobility goals, they are more likely to go home sooner, and have less complications.
So we targeted two different populations for this project. For the lower extremity total joint replacement patients, mobility is crucial. It improves range of motion, which in turn increases the likelihood of this patient population going home versus rehab. Being discharged to home improves patient outcomes, and it also decreases readmissions.
Ambulation is a key element for our open heart surgery patients. Each day, patients are required to walk a certain distance, which is outlined by our open heart surgery pathway. Ambulation has proven benefits and works synergistically with our other goals on the pathway, such as volume overload, motility, and incentive spirometry. All of these are important because if the goals are not achieved, it delays patients' discharge. Although we are two totally different units with different patient populations, we found that we have very similar ambulation needs.
Since CUP 5 started their early mobility program, we have seen a decrease in our length of stay, an increase in our discharge to home by 33%, and a decrease in our falls, but we still can do better.
So meet Greg. Greg is a nurse on CUP 3 East. An ongoing joke on the unit, and a very long story, is that we nicknamed Greg Turtle Dove. And as a joke, we put a little image of a turtle dove inside a landscape painting that Greg loves on the unit. Greg was also Carol's nurse. That day that Greg was caring for Carol, he recognized the challenges to mobilizing her. Greg came up with the idea of telling her to find the turtle dove that we had hidden. With a lot of encouragement, Greg was able to get Carol out of bed, out of her room, and into the hallways, searching for the turtle dove. Each day, Carol's mobility and confidence improved. Greg now does this with all of his patients. Patients feel like the room is their only space. So this helps them ambulate more because they're exploring the hospital floor and are distracted by their pain. We have incredible nurse clinicians on our units, and we can add elements to ambulation to make it fun. We also found that adults actually like to play the games too. But this is not just about fun and games, it's about playing games that matter.
So what's good about Greg and his turtle dove? He's gamifying mobility. We wanted to explore how gamification could address the barriers to mobility that we had seen on both floors. Some of those barriers were lack of motivation because the patients were fearful, lack of clear goals, the patients didn't know what their mobility goal was for the day, and really not having an easy way to track their progress. So some of our insights for these barriers, we came up with some research questions. How might we make mobility something to look forward to rather than to fear? How might we make daily mobility goals easier for patients to understand? And how might we help patients know where they are in reaching their goals? We did 4 experiments with 120 patients over 6 months, and some things worked better than others. The first thing we tried were activity trackers. For the total joint replacement patients, they all use walkers, so we couldn't track the steps using the activity bands. Thinking that our opportunity was to either put the trackers maybe on their ankles or to maybe put accelerometers on their walkers. The MobiliBuddy was a nurse texting that we used, and it actually over time the engagement declined, and we also the texting became white noise. The couple of things that worked really well were the 3 East Safari and the Get Up and Go on 5 South. They both engaged the nurses, created landmarks on the floor, and gamified mobility to having patients search for something.
So here we are on 3 East. We were inspired by Greg's turtle dove story, so we made it a 3 East Safari. So what you can see in this picture is that a nurse put a penguin in that portrait for their patient to go and find. And the nurses put the pictures there based off of the distance that they thought the patients could walk, so they individualized it for each patient. So here are our results. Patients in the intervention group, which were the ones in the safari group, were ambulated almost 350 feet further a day than those in the control group.
So Get Up and Go is a mobility project that creates a destinations for patients to ambulate instead of a distance. For example, instead of telling the patient that their pathway goal is to ambulate 150 feet, we tell the patient their goal is to ambulate to the tropical region 3 times that day. The patients then collect the cards, and they take the cards back, and there's a scorecard in their room so that they can keep track of their goals every day. We found the patients that participated in the Get Up and Go walked 50 feet more than our control group, that 88% of our patients in the intervention group met their pathway goal for discharge compared to 40% in the control group. So what we have learned: benefits of gamification. It motivates patients to ambulate. It improves communication between patients and staff, and it improves patient experience. We actually had a patient write a really nice comment on their Preskini survey when she did the pilot, and she wrote a really nice survey comment saying how much she enjoyed it. But there are more things that we can do. We need to tailor the program to the patient's functional status. We would like to reinforce games with the staff, and we'd also like to look at some technology solutions that measure daily activity. So we're really excited to continue to work on this project. Our vision, short term, we'd like to do a deeper dive to see what else we can do, and we'd like to scale it to all the patients on both of our floors. Long term, we'd like to scale it to patients on different floors of the hospital and possibly to different hospitals in the entity. And we'd also like to develop a mobility toolkit. And these are just the people that we'd like to thank for all their help in making this project possible.